When a local doctor was still an undergrad in college, he thought he wanted to become a bush pilot, flying for help or resources to remote parts of the world. But one summer spent working at a leprosy clinic in Niger changed his mind. He came back and decided he would become a surgeon. Now Dr. John Francis is treating people here at home and training physicians in Africa on the best way those doctors can treat patients in often less than ideal conditions. In tonight's Heroes Among Us, we'll talk with Dr. Francis and find out why it's in his heart to help. Pictures from mission hospitals in Niger and Gabon in Western Africa tell the story of Dr. John Francis. For the last several years, he has made sometimes 3 trips a year overseas to help train physicians working in Africa.
Over there, if you're the general surgeon, that means you're a general surgeon. You do everything, all the way from eyes, ears, brain, you name it, been involved with it.
Dr. Francis is a general surgeon, part of the team at the Lafayette Surgical Clinic. He's also the trauma director and chief of surgery at Franciscan St. Elizabeth Health. Francis says he can make medical mission trips to Africa because of his partners. Dr. Tom Summer is going to Kenya next month.
This we think is kind of an obligation we have. God's been good to us. It's our chance to use our skills elsewhere in the world, and so when one guy's gone, the others jump in.
Dr. Francis says his job in Africa is to help physicians think outside the box. What may work in the United States is not always the right medical treatment for patients living in the Congo. One woman who lived in the jungle had melanoma on her foot that had spread. Doctors in Africa were going to amputate her foot to try and give her more time. Dr. Francis asked those physicians to think of what might be best for a woman who does not have access to chemotherapy or a prosthetic.
Now, what's the other option? He said, well, we can leave it and just clean the wound out. And I said, we can leave it and clean the wound out and she can walk, versus taking the leg off and trying to get around through the jungle at her home with no leg because there's no prosthesis. And he had to stop and think about this and realize, yeah, I guess in that situation, the book answer is you do an amputation. The real life answer is you treat the patient. So teaching them to think outside the book and what's best for the patient is part of the number one thing I do there.
He says it's important to train and work alongside doctors in Africa instead of bringing them to the United States to study Western medicine. He says here we have specialists and options. Dr. Francis says in parts of Africa, one doctor may be treating millions of people with very few resources.
Over there, you don't have the consultants, so it's up to you to make those decisions.
Dr. Francis says it's his faith in God that drives him to make medical mission trips as much a part of his practice as his patients locally. Francis says he was given the gift to be a surgeon, a skill he says should be used to help as many people as he can get to.
I'll go places that it's either too hot, too dirty, or too hard to get to. Is really where I go, because if you can find someplace easier to go, other surgeons can get there, they'll go. And so I'll just tend to go to the places that they just can't get people to go to.
Dr. John Francis is also a trained pilot, and when he's not working, competes in aerobatic flight. He says it's ultimately his goal to spend most of his time overseas directing training facilities for physicians in Africa.